Welcome. Thank you for spending time with us to learn more about the Silagen line of scar management and post-procedure recovery products. First, we will discuss scar management and how the Silagen scar refinement system can benefit your practice. I think we all can agree that scars are problematic. The patient may experience pain, itchiness, and tightness. They may be upset and emotionally impacted by their scars, and scar appearance may also make them dissatisfied with their surgery experience. So not only are scars problematic for the patient, but also for your practice. Dissatisfaction may lead to the request for scar revision surgery, which takes a surgeon's time and supplies. Dissatisfied patients may become confrontational and difficult for the office staff to deal with. And in today's digital age, the dissatisfied patient is more likely to write a review than a satisfied patient. By adding Silagen to your post-surgical protocol, you can help prevent problematic scars, reducing the time, energy, and emotion spent with dissatisfied patients. In years past, it was common to take a wait-and-see approach to scar treatment. Scars were only treated if they became hypertrophic scars or keloids. As topical silicone gels were developed as an option to silicone gel sheeting, doctors began experimenting with the gel to help prevent those scars from forming in the first place. There are many risk factors to developing scars, but those risks are often unknown. Therefore, scar prevention is warranted for all patients. In 2004, the International Clinical Recommendations on Scar Management were published, and in it, the authors discussed the idea of using silicone to prevent abnormal scarring and included it in the treatment algorithms. In 2013, guidelines for treating Asian patients were published, and in 2014, both an update to the original guidelines plus European treatment guidelines were published as well. These updated guidelines provided more support for moving to a prevention strategy rather than the wait-and-see approach, noting studies that confirm the efficacy and safety of silicone for scar prevention and treatment. Utilizing a prevention strategy is very important for patients at high risk of abnormal scar formation due to past history, Fitzpatrick skin type, and scar location. This illustrates the current treatment algorithm for scar prevention. Silicone is recommended as first-line therapy for patients at an increased or high risk of abnormal scar formation. It's also the first-line recommendation for patients who are at a lower risk but express concern over their final scar appearance. Given the nature of aesthetic surgery, it's safe to assume all of those patients are concerned about the final appearance of their scars. Here we have the published treatment algorithm for immature and linear hypertrophic scars, as well as widespread burn scars. As you can see, silicone is again recommended as the first-line treatment. Additionally, in the event of surgical excision of a linear hypertrophic scar, the authors recommend the use of silicone gel or sheeting postoperatively. Finally, we have the algorithm for minor and major keloid management. Once again, silicone plays a role in the initial and post-excision treatment. Given the high recurrence rates of keloid scars, it is important to be proactive in preventing the reformation of those scars post-operatively. One thing you may notice is the lack of support for other ingredients, such as vitamins or plant extracts, often added into other scar products. It's the opinion and recommendation of the experts that for scar prevention and treatment, silicone is the only non-invasive option with enough clinical evidence to merit recommendation. We now know what the scar experts say, but what do patients want when it comes to scar prevention? A published study surveyed 97 postoperative patients with diverse ages and ethnicities to ask their opinions on scarring. It is no surprise that the results showed that patients were highly concerned about scarring following routine surgery, with most patients valuing any improvement in scarring. 75% of patients agreed that they would go to any length to reduce the possibility of scarring, and 91% agreed that even a small improvement in scarring on a visible body site would be worthwhile. It is important to realize that your patients aren't necessarily expecting miracles or that their scars will completely disappear with treatment. Many patients are hesitant to express their concerns about scarring, making it a good practice to ask patients if they are interested in scar prevention products. You'd be surprised even the most unlikely patients will be worried about their scar appearance. Not only can silicone prevent abnormal scar formation, it may even make otherwise normal scars even better. The left photo shows one breast of a bilateral breast reduction before treatment. The center photo shows the breast treated with silicone sheeting for 7 weeks. The scar is barely visible. The photo on the right is the untreated breast after 7 weeks. This is a pretty good-looking scar. It is flat and only slightly discolored, definitely not a hypertrophic scar or keloid. This shows that the patient would have likely healed normally on both sides with no treatment, but with this preventative treatment, they got better than normal results. If you showed your patients these 3 photos and explained them, what percent would say, "I'll have what she's having"? I bet a majority would choose the treatment option. Silicone is the gold standard in preventing abnormal scarring, but how does it work? The current mechanism of action theory is that silicone provides a barrier over the new scar tissue by restoring the water barrier through occlusion and hydration of the stratum corneum. When a wound reepithelializes, it produces type 3 collagen to quickly repair the deficit. That collagen does not have the strength or density as the type 1 collagen that it will eventually mature to. This immature stratum corneum allows too much water to evaporate, which signals for cytokines to tell fibroblasts to make more collagen to strengthen the barrier. Think of it as your body essentially plugging a leak in its roof. More collagen deposited results in raised scars. Using silicone over the immature scar stops the potential for transepidermal water loss and prevents signaling for more collagen. The scar will heal flatter and softer. We have talked a lot about prevention, but we need to remember that silicone can also be used to improve existing hypertrophic scars and keloids. Multiple clinical studies indicate that silicone gel and sheeting are effective in reducing the redness, hardness, elevation, itch, and pain associated with abnormal scars. Flat hypopigmented scars will not likely improve with silicone treatment, but as long as the patient's scar has one of these 5 parameters, there is a good chance they will see improvement with treatment. So how old is too old? We get this question quite often. Obviously, the sooner the scar is treated, the better, but there is clinical evidence of improvement in scars up to 4 years old. Doctors often tell us they have seen improvement in scars much older than that. The scar in the photo is from a hip replacement done 10 years previously. The patient tried our silicone sheeting on just the lower half of his scar. You can see a distinct improvement in the discoloration here after only 3 weeks of treatment. While it may not make an old scar disappear, there is a good chance the patient will see some improvement in their scar. Another common question is, when should the patient begin treatment? Treatment should not be started until any sutures have been removed and the scar is completely reepithelialized. Usually 7 days to 2 weeks after surgery is a good time to begin treatment. Doctors often discuss scar prevention at the follow-up appointment after surgery and guide the patient when to begin based on what they see. Next up, we'll talk about our Silagen silicone gel sheets. Silagen silicone sheeting has 3 layers. The middle layer is 1 millimeter thick of self-adhering medical-grade silicone. The top layer is either a clear polyurethane or a beige-colored lycra spandex fabric. The bottom layer is a peel-off liner that is removed before application. A unique feature of the sheeting is that there are no added adhesives. The silicone is cured in a way to make it sticky. The self-stick feature makes it tolerable for patients who are sensitive or allergic to adhesives. Silicone is one of the most biocompatible materials and should be well tolerated by all. I mentioned that Silagen sheeting has a 1 millimeter thick silicone layer. This is important. There is a direct correlation between the thickness of silicone sheeting and the amount of pressure applied to the scar. We know that pressure can be beneficial for scar management. It helps reduce tension on the scar, and it can help flatten an older raised scar. University of Wisconsin-Madison Engineering Research Center tested Silagen sheeting as well as 2 other brands sold at drugstores. Silagen was significantly thicker than those products and achieved up to 5 times more pressure than those thinner products. Here you will see all the measurements captured during the study. You can see a direct correlation between the thickness and pressure. Silagen is significantly thicker than the drugstore products and applies significantly more pressure. The added benefit of a thicker silicone product is that it is more durable and it will last longer. Silagen sheeting is washable and reusable, offering a better value for the patient. This photo shows how the different Silagen backings look when applied. The beige option is slightly thicker and may be slightly more durable. The clear sheeting is more flexible and is less noticeable on the skin. Silagen has the widest variety of sheeting sizes and shapes to fit the needs of all scars. The options pictured here are some of our most popular sizes and are good for smaller scars, irregularly shaped scars, and larger surface area scars such as burns. For longer scars, such as those from body contouring surgery or other procedures creating scars more than 6 inches long, Silagen offers 3 sizes of 2-inch wide strips. These strips can also be cut into multiple pieces for shorter scars. The 1-inch dots cover tiny incisions, such as those resulting from biopsy, small lesion removal, and liposuction. The extra large sheet is the biggest size available and can be used for burns or other large surface area scars. Finally, we have a selection of shapes designed specifically for breast surgeries. These are useful for a wide variety of procedures, from full anchor breast reduction to gynecomastia. The 4-piece breast kit is very popular and offers a better value than purchasing the areola circles and anchors individually. One of the newest products in the Silagen line is the Bella Button Umbilical Shaper. This patent-pending 100% silicone insert helps achieve an ideal oval-shaped belly button and helps to prevent or treat constricture of the umbilicus. It is available in 2 different sizes and comes in a kit with tape and cleanser. One of the great features of our silicone sheeting is that it is washable and reusable. Each piece should last 3 to 4 weeks of daily use if it's cared for properly. Silicone sheeting can be cleaned with soap and water. We offer our Silagen Clean Foaming Cleanser for silicone sheeting to make it easy for the patient to find an appropriate product. This product helps restore the adhesiveness of the sheeting. It's fragrance-free, sulfate-free, allergy-tested, and non-irritating. They could wash their skin with it if they want to. One thing that you do not want the patient to do is use a creamy-based type of cleanser that might have moisturizing ingredients or oils in it, because those types of products will not get all of the dead skin cells, the dust, the dirt, the lint off the adhesiveness. It will not, and it will also impede the ability of the sheeting to stick to the skin. Patients feel they get a better value for their money when their sheeting lasts longer. If you care for the sheets properly, it will extend their life and they will feel that they've gotten a better value. All Silagen sheeting orders include patient instruction sheets. You will receive 1 sheet per item purchased. They give specific directions for using the sheeting on one side and for gels on the other. Hopefully, this will cut down on the calls to your office with patients seeking more help on how to use their product. Occasionally we hear about a patient that has super sensitive skin and they get a little bit of a rash when they start using the sheeting for a long period of time. If you have a patient that has highly sensitive skin, begin using the Silagen for 4 hours per day for the first 4 days and inspect the site often to make sure you're not getting that rash. If there is no significant rashing or irritation, you want to increase the usage by 2 hours each day going forward until the desired usage time is reached. Silagen should be replaced if it begins to deteriorate, disintegrate, or will not stick. Now let's talk about the 3 Silagen topical scar gels. Another common question is, which is better, the gel or the sheeting? International scar treatment guidelines state that silicone gel and silicone sheeting are equal in efficacy based on clinical studies, but due to ease of use, patients might be more compliant with the gels. There are times when gels might be more appropriate. Scars in a visible area where sheeting would be noticeable, areas with joints and flexures where the sheeting would have difficulty sticking, and for patients who do not want to use the sheeting or likely will not comply with the sheeting treatment, the gel is a better option. Where sheeting may be more appropriate is in older scars where added pressure would be beneficial to help flatten the scar. That would be like existing hypertrophic and keloid scars. If you have patients that are at high risk for developing hypertrophic scars and keloids, or if you have just done scar revision surgery on a patient who had a poor scar outcome previously, it's a good idea to use the sheeting because it can be a little bit more of an aggressive treatment than the gel. Finally, scars that are sensitive or rub against the clothing can be problematic for the patient. The physical barrier of the sheeting can help cushion and protect the scars and help prevent the sensitization that the patient gets from touching it, and also prevent any inflammation that rubbing can cause. The first product to discuss is the Silagen 100% Pure Silicone Gel. This 100% medical grade silicone gel is registered with the FDA as a Class 1 medical device. It is purely silicone. There are no other added ingredients that could cause sensitivity or irritation. The gel is odor-free and has a soft, silky feel on the skin. It dries quickly and is non-comedogenic. For best results, the gel should be applied in a thin layer every morning and night for 3 months. Older scars may require a longer course of treatment. The gel comes in airless pump bottles in both 15-gram and 30-gram sizes. The 15-gram size should be enough for a full course of therapy on a scar 3 inches or less in length. The 30-gram size is recommended for scars more than 3 inches in length. The next product is the Silagen Silicone Gel Plus SPF 30, commonly referred to as Silagen UV. This gel combines our medical grade silicone with micronized zinc oxide to prevent hyperpigmentation due to UV exposure. It offers broad spectrum protection and should be used on scars on any part of the body that's commonly exposed to the sun, even if that sun exposure is incidental. This is a great product to use for scar prevention. Like its pure partner, Silagen UV is odor-free and has a soft, silky feel on the skin. It dries quickly and is non-comedogenic. For best results, the gel should be applied in a thin layer every morning and night for 3 months. This gel also comes in an airless pump bottle with both 15-gram and 30-gram sizes available. When many people hear zinc oxide, they think of a very dry white paste that goes on the skin, similar to what lifeguards used to use on their nose. Now that we have a micronized version of zinc oxide, you're able to format zinc oxide sunscreens that can actually dry clear on the skin, and this is due to the smaller particle size. There are products out there that contain nanoparticles or nano zinc oxide, which is even better to make a clear product. However, it can be controversial due to the effect on people's health and the environment, and it's actually nanoparticles are prohibited in many countries. Our R&D team spent a very long time developing our Silagen UV formulation. They started with our silicone pure gel, which makes up 80% of the product, and they've added micronized zinc oxide that comes suspended in a liquid, and that equals 20% of the product. This gives us the SPF rating while keeping a product that is very mild and safe and non-irritating for patients. The instructions for use for both Silagen gels is the same. First, wait. Make sure the scar is ready, no sutures, no bleeding. Next, wash and dry. We want the skin to be clean and free of any lotions, serums, powders, etc. This will enable the gel to bond to the skin better for a longer lasting wear time. Finally, apply a very thin layer and gently massage to spread completely over the scar. One of the biggest mistakes patients make is applying too much product. For a scar up to 3 inches, use an amount the size of a sesame seed. Yes, really. A little bit goes a long way, and it's easier to add a little more if needed to cover the entire scar. The patient will get many more applications from the bottle if they apply it this way. The newest gel added to our lineup is Silagen Reveal. This product was originally launched with the name Acne Scar Plus Spot Corrector. However, after clinical study results and input from clinicians, we realized that there is a much wider group of patients who may benefit from this product. We named the product to Silagen Reveal as it can help reveal your patient's true skin potential. Reveal Gel was formulated to tackle 3 of the most common skin issues: hyperpigmentation, redness, and uneven texture. We researched which ingredients address those issues and then determined the concentration needed for it to be effective. In particular, we look for multitasking ingredients that offer multiple benefits. We have identified the activities of each ingredient in this chart. The key ingredients are azelaic acid, bakuchiol, 2 different types of vitamin C, vitamin E, acetylzingarone, licorice root extract, medical grade silicone, glycerin, hexylresorcinol, and caprylic capric triglyceride. In order to reduce post-inflammatory hyperpigmentation, we need to prevent new hyperpigmentation and also clear the spots that have already appeared. We've loaded up on tyrosinase inhibitors to suppress melanin production. These tyrosinase inhibitors include azelaic acid, vitamin C, hexylresorcinol, licorice root extract, and bakuchiol. Multiple ingredients are also proven to help fade existing dark spots, including azelaic acid, bakuchiol, vitamin C, and licorice root extract. Silagen Reveal also improves the appearance of skin redness. Redness may be caused by conditions such as rosacea or form after inflammation from acne. Redness is caused by dilation, inflammation, or damage to the small capillaries right under the skin. To correct redness, we must reduce inflammation and generate new collagen to normalize vascularization. The 2 versions of vitamin C, ascorbic acid and tetrahexyldecyl ascorbate, plus 10% azelaic acid, are able to achieve this. Collagen generation and exfoliation are keys to revealing a smoother skin texture. Acne scars in particular can cause an uneven, pitted skin surface. Texture issues may also occur with other conditions such as rosacea and keratosis pilaris. How does Silagen Reveal help improve skin texture? It includes 5 ingredients that have demonstrated the ability to influence collagen production. These ingredients include the 10% azelaic acid, 2 types of vitamin C, medical grade silicone, acetylzingarone, and bakuchiol. Azelaic acid and bakuchiol do double duty as they are also able to aid in cell turnover and exfoliation. Dr. Bruce Katz and his team conducted a clinical study on the efficacy of the product. Dr. Katz reports that his team was very impressed by the findings, which showed that 18 of 20 subjects were found to have objective and subjective improvements in both texture and hyperpigmentation. He states that we can now confidently recommend this product for acne scars and hyperpigmentation. This study was published in the Journal of Cosmetic Dermatology in March 2025. These are images of 2 of the study patients and were captured by a Vizia camera. This shows the improvement in the redness on the left 2 images and improvement in pigmentation on the right 2 images. This was after 12 weeks of using the product. No other topical products were used during the 12 weeks of this study. Dr. Lori Estalo shared images of 2 patients who presented with significant redness and acne scarring. Both patients had an improvement in redness over baseline. The result in the left photos was achieved after only 1 month of treatment. Dr. Abraham Kazemi shared the success of one of his teenage patients. This patient was post-isotretinoin, but was still left with significant scarring. You can see significant improvement in redness, hyperpigmentation, and texture. Silagen Reveal is non-comedogenic and safe for acne-prone skin. Unlike other lightening products, Silagen Reveal can be used on all Fitzpatrick skin types. The gel can be used in conjunction with other acne scar treatment modalities, including laser and microneedling. The gel should be applied twice daily, morning and night. Due to the stubbornness of hyperpigmentation and acne scars, we recommend using the gel consistently for at least 4 months. This is the treatment course used in our clinical study. Note that it is still important to protect the treated areas from the sun. A sunscreen should be applied after each morning application has dried. In the clinical study, all patients used our Silagen UV as their sunscreen each morning. That wraps up the discussion of the Silagen Scar Refinement System. Now it's time to talk about the Silagen Rapid Recovery System for post-procedure bruising and swelling. Bruising after injectables, lasers, sclerotherapy, or other procedures causes extended downtime for the patient. This downtime keeps the patient from participation in normal social activities. Your clinic's goal is to keep the patient coming back for more, but extended downtime can be a big deterrent to repeat business. What can you do to solve this issue? You can help accelerate the clearing of bruising and swelling with the Silagen Rapid Recovery System. Silagen has the ultimate pair for post-procedure care, our arnica bromelain supplement and our topical recovery gel. Using these products together maximizes results by treating bruising and swelling from the inside and out. Reduced downtime equals happy patients and happy doctors. In order to clear bruising and swelling, a product must do the following. It needs to reduce swelling, reduce inflammation, reduce bruising by increasing blood flow to clear the leaked blood and strengthen the capillaries, needs to promote wound healing and cell repair, needs to soothe the bruised and swollen area, and it also should increase moisture for barrier repair and barrier maintenance. As we did with the Silagen Reveal formulation, we identified and selected ingredients that have been shown to achieve the required activities to accelerate bruise clearance and reduce swelling. We then researched the ideal amount of each ingredient needed to achieve therapeutic benefit while remaining safe for the patient. We were able to create a concise list of ingredients that covered our needs. As you can see, many of the ingredients serve triple duty or more. Arnica and bromelain are the hero ingredients in the supplement. These two natural, plant-based ingredients have been used for decades, if not centuries, to treat bruising and swelling. We have sold more than 200,000 bottles of this supplement since its introduction. It is definitely a must-have for injectors. Silagen Arnica Bromelain Complex offers your patients the convenience of arnica and bromelain all in one product. Taken twice daily, the capsules will promote accelerated improvement and reduced downtime. There are enough capsules for 7 days of treatment, but many are happy with their results after just a few days and save the rest for their next treatment. In addition to our hero ingredients, the supplement also offers high-potency vitamin C, which is buffered for better tolerability. Hesperidin and diosmin, citrus bioflavonoids, are added in the necessary 1:9 ratio for maximum effectiveness, and we use the methylated form of hesperidin for better bioavailability. All extracts are standardized to ensure potency and consistency. We have changed to a capsule format instead of the previous tablet to make it easier to swallow. If you've used the tablets before, note that 1 tablet equals 2 capsules, so the dosage has now changed to 2 capsules twice daily. The switch to capsules also eliminated the need for extra filling and binding ingredients, making them an even cleaner supplement than before. As always, the vegetable capsules are vegan-friendly and gluten-free. Now that we've attacked bruising and swelling from the inside, let's talk about the topical recovery gel. The featured ingredients are arnica, bromelain, and 2% vitamin K. The gel comes in a 20-gram tube, which is significantly larger than many of the other professional bruise topicals. Just like the supplement, the topical recovery gel includes ingredients shown to achieve the desired activities at concentrations documented to achieve results. It's not just what you include, but whether there is enough of everything needed to make a difference. Silagen Topical Recovery Gel features 20% full-strength organic Arnica montana, not the highly diluted homeopathic kind. Clinical studies show better results with high concentrations of the full-strength Arnica, and the 20% concentration used in Silagen was tested in clinical trials and shown to speed bruise clearance. 2% vitamin K works synergistically with the hesperidin and L-arginine to help increase blood circulation and remove leaked blood. The liposomal delivery system ensures deeper penetration into the skin. Another synergistic pair included in the formula are vitamin C and vitamin E. These two vitamins working together have been shown to speed the breakdown of the iron in the leaked blood so that it can be absorbed faster. The balance of the gel formulation includes multitasking ingredients that have anti-inflammatory, antioxidant, soothing, and moisturizing properties. Doctors and patients will appreciate the value of the 20-gram tube size, which is 50 to 100% larger than many of the other professional brands, but it is priced comparatively the same. Silagen Recovery Gel with vitamin K is now available in a large back bar size. The pump bottle makes it easy to apply the gel immediately after injectables or other treatments that may cause bruising. This also facilitates a discussion with the patient about purchasing the Silagen Arnica Bromelain capsules and gel for home use. We listened to feedback from our clinicians and now offer a larger sized bruise gel. The 60-gram gel contains caffeine instead of vitamin K and is ideal for larger areas of bruising that can result from procedures like liposuction or chronic conditions like actinic purpura. It offers 3 times as much product as the 20-gram tube. Topical caffeine has a long history of use and safety. It is a vasoconstrictor and can help reduce the leaking of blood from vessels that cause the bruise discoloration. Caffeine also has anti-inflammatory and antioxidant properties. The bruise supplement and topical recovery gel are also available packaged together in a kit. The kit includes the 28 capsule supplement bottle and a 20-gram tube of topical recovery gel. There is a savings of 20% by purchasing the kit compared to buying each product separately. Recommend the kit to fight bruising and swelling from the inside and out. The Silagen family of products fulfills most of the post-procedure needs of your patients and your practice. We offer post-op and post-procedure scar prevention, the treatment of hypertrophic scars and keloids, and a solution for redness, hyperpigmentation, and texture issues. Downtime can be shortened using the combination of products offered for bruising and swelling. You will find the Silagen products to be a better value compared to other professional brands, and you have the benefit of having only one vendor to provide it all. Silagen is happy to provide support materials for all of our products. We offer brochures and brochure holders, self-adhesive posters, product testers, patient instruction sheets, pull-up banners, ready-to-post social media graphics, product images, logos, and more. Follow us on social media and collaborate with us on things you post about Silagen. Our marketing team, social media team, and your local sales rep are happy to work with you so you can offer the full Silagen experience to your patients. Recommending Silagen relieves scar anxiety, reduces post-procedure downtime, and make patients feel cared for, confident, and happy. And we know that happy patients refer their friends and family to your practice. Thank you for taking the time to learn more about Silagen. If you have any further questions or would like more detailed information, just ask your rep. They'll be happy to help you.